And our last speaker of the day is Dr. Imelda de Groot. I've known Dr. de Groot for many years. I probably miss saying your name, and I apologize for that. She's a physiatrist in the Netherlands who's done an incredible amount of work on care for Duchenne families and how best to think about them, in addition to her work on outcome measures. So, with that, I'll turn it over to Dr. de Groot.
Thank you, Pat. Yes, as you already said, you pronounced my name wrong, but it's a very difficult name, I think, because the G is very difficult for people not from the Netherlands. So I'm
I
actually,
apologize.
yeah, but it's a soft one, De Groot. So, um, yeah, thank you for the organizers to invite me, and I'm going to talk about training or being active, and I want to focus on two topics. Why should we train the boys, and how can we do it? Because when I started as a young rehabilitation physician, then the general was that you're doing enough during the day, so you don't need extra exercise or training. But now that at the end of my career, I know that that's a wrong assumption. We should train the boys, and one of the reasons why is that if you look at what the World Health Organization is telling us, is that children should be active for around 60 minutes per day, and the best would be some moderate or strenuous or tiring activities, while adults should at least exercise for 300 minutes per week with moderate and add some strength exercises. Well, we all know that this is not fully applicable to the Duchenne population, but to some extent, we need to keep the boys and the men active because it has serious consequences for their life, for their cardiac and their lung health. So what are we talking about? We are talking about moderate activities, and it's not a very short limit, but say your heart rate is around 120 to 140. So if a boy plays in a very exciting video game, it's already raising to around 120. But tiring, strenuous exercise is really one that we feel our heart beating in our chests. So it's you can actually tell yourself whether it's moderate exercise you're performing or whether it's more tiring or strenuous exercise. But you should know, and probably you all know, that the boys with Duchenne and the men with Duchenne always have a higher resting heart rate, except when they are using medications for the heart, but they are always a little bit higher. So a normal boy would have a resting heart rate from around 70, 80 beats per minute, while a boy with Duchenne can easily have 90 to 100 beats per minute. And one of the questions when I started all the research on training was, well, is this normal? Can actually the boys with Duchenne have the same um, stimulus of exercise as healthy boys? When we started to examine training, we also wanted to know how active the boys were. So this is a publication we did a couple of years ago, done by Lotte Heuting. And we asked by a questionnaire to healthy boys, which is the top bar, and all kind of boys with Duchenne and men with Duchenne in the early ambulatory stage, in the late ambulatory stage, in the early non-ambulatory stage, and in the late ambulatory stage. How often are you performing light exercises or more strenuous exercises? And the light bars give the percentage that are the boys that are performing more than 6 days per week light exercises, and strenuous exercises are the more dark ones. The dark ones resemble the fact that you're doing less than 6 days, so 1 to 5 days, or the black ones show the percentage that they are not performing, doing anything, so no exercise at all. And when you compare healthy boys with the boys that are in their early ambulatory phase, you can already see a difference between the healthy boys and the boys that are having Duchenne. They are doing less strenuous activities and they're doing less. They are doing more light exercise than strenuous activities. And when you go on, then you can see that actually they are doing less and less. So in the late ambulatory, non-ambulatory stages, most of the men are doing nothing. And if they are doing something, they do it less than 6 days per week. Well, the best thing to do would be about 4 to 6 times per week doing some kind of exercises. So during the course of Duchenne, the physically active activity is decreasing. And that means that we should find some reasons why they are not that active anymore during the course of their disease. And we asked them, what do you think about the exercises? And we asked them about the benefits and the barriers. And if we look at the benefits, then the total boys of Duchenne actually said, well, I like exercise because they are giving fun. And another one was that I'm making friends, and it's comparable with the healthy boys, which is in the last row. But there are also barriers, and the barriers were the lack of sport facilities, and that's much more in the Duchenne population than it is in the healthy population, and it is also difficult large distances because we all know that they can play wheelchair hockey or swimming, but you have to go to those places. So when we thought about exercising, we thought we should find something that could be done at home also, next to, for example, wheelchair hockey once per week or once per 2 weeks, which is quite low exercising. But there is another point that when I started and I learned from the boys and the parents most of all my knowledge, when I started, I was thinking about the fact that the disease itself actually, and you all know that, reduces the muscle strength and the endurance. And that leads to disabilities. And I could see that the boys who are at the end of the ambulation stage were less walking because they were afraid of falling, or it was too much for them, or they used the wheelchair because they were quicker. But if we give too quickly all kinds of ads and or like wheelchairs, or that electrical wheelchairs that they only have to use their joystick for, then it leads to inactivity in the arms, inactivity in the legs if they are walking less. And this inactivity, we all know, if we go lie down for 1 week in the bed because we have flu or something like that, we have difficulty to getting again back to our physical status. So inactivity gives muscle mass reduction. And one of the thoughts I had was, can we prevent those disuse, because inactivity due to the fact that we are helping them too much, uh, can we prevent disuse by any form of training? So if you know the why should we exercise, then it's to prevent or reduce disuse. And the other reason why we should do exercise or training is to promote a healthy lifestyle, which a healthy lifestyle will prevent or reduces the risk on cardiovascular and respiratory diseases. And we all know that Duchenne are at risk for cardiovascular and respiratory consequences, that they have the involvement of the heart and of the respiratory muscles. But the next question was how to train and how to do exercises. And based on the fact that these boys had difficulty to get to normal swimming pools or to get to rehabilitation centers where they could exercise, we thought of home training. And I thought, what can we do in home? What kind of type of training can we do at home not with the involvement of the parents, because they are already having a lot of time in taking care of their boys, so not extra time to practice with their boys, to exercise with their boys. And normally you think of an ergometer or a home trainer. So I tried it out on a young boy. Can you cycle on a normal home trainer, a normal ergometer? And he wasn't able. It was still a very well. It was a boy in his early ambulatory stage still. So we found another home trainer, an ergometer, which is electrically supported. It had 7 supporting levels, and you can train on your preferred support. And you can train your legs by cycling, and you can train your arms by cycling. And you can do it in front of the telly, or you can play a video game with your arms and hands if you're cycling with your legs. So it can be challenging if you combine it with a video game that like you challenge the boy to increase his level by cycling. And this was the basis for the no use is disuse study. And we said, well, if it's really effective, then it should be uh, performed for a very long time, because most training studies are done for 3 months, and 3 months is quite achievable. But 6 months, then you need a long time of training, and you must keep your motivation up. And we asked the boys to train 3 to 5 times per week for uh, twice 15 minutes, 15 minutes for the arms, 15 minutes for the legs. And they did. So we had no uh, boys that stopped during the training. They all reached their 6 month training period, and they even liked it, and they took their cycles with them on holidays as long as there was electricity in the neighborhood. So it was a very effective training by the idea that you can do it at home, you can do it everywhere you like to. And we also checked whether this was really a moderate activity. So we looked at the heart rates of these boys, and in blue are the healthy boys, and in green are the Duchenne boys. How the heart rate is increasing? Well, we asked them to cycle as fast as they could for 6 minutes. So you can actually see that the boys with Duchenne are starting a little bit higher. As I already said, they have a higher heart rate. And also the boys with the healthy boys were a little bit high for their norm, but we thought they were a little bit excited about everything. And you can see the similar pattern. You can actually see that the boys with Duchenne also reached the moderate level for exercising. And at the last point, we asked them to cycle as fast as they can, and you can see there is no difference between boys with Duchenne and healthy boys. So this is really a very good training on a moderate activity level. We didn't ask them to give more strength or something like that. We just asked them to cycle. This is a dynamic training form. And the results of the no use is disuse study was measured with the motor function measure, which measures the all kind of activity levels in the arms and the legs and the trunk. And the training group stayed during the 6 months more or less stable, while the non-training group, the control group, decreased in their functionality. And if you look at the individual results, you actually see some variation, of course, but the training group did much more better than the control group, where you can see that except for one person, every boy deteriorated. Well, in this group, most of the boys even improved, which was not our intention of the training. We just tried to stabilize it to prevent disuse. But you can actually see that there can be a little bit turned around if you do enough exercise. We did another study to see whether this is also applicable if you use the arms, because we did cycling with the arms, which is not a normal way of moving your arms. But we did a study with a 3D movement. So the arms were supported by controls. So the weight of the arms was decreased, so they could move in all directions, although they were with the fact that they couldn't move above their head already, and they played video games with this also half an hour a day. And again, we looked at the results, and this is a very small study because we didn't have many boys in it, but you can see that the group that is training is really better than the group that's not training with video games. The problem with the fact that we used quite large arm supports is that they couldn't do it easily at home. So we hopefully we have some better arm supports in future, and we can do those trainings exercise also at home for the boys that are already wheelchair bound and are still able to use their arms with a support in a supported way. We are not the only groups that examined the training. Also, a Turkish group did it, and they had the same results. But there are very little evidence on training in boys with Duchenne, especially in the older ones. So is a field still open for young researchers. Uh, so I encourage young researchers to answer all these remaining questions from uh, well, we noticed that our boys trained 3 to 5 times per week, but is 3 times enough? Can you do it with 2 or 3 times? And how beneficial would be adding strength training? Because now we did a dynamic training, which was more on the aerobic, so the cardiovascular training and pulmonary training, than on the really muscle strength training. We didn't aim at that. And what we would like to know is what are the changes due to those type of trainings in the muscles? Because MRI studies showed that uh, in especially in arm muscles, there could be quite a lot of disuse, and not the degeneration due to the muscle disease, but really disuse. And we all are also looking at more effective ways to training. You would like to have children to be able to train in their home environment, but not only at home, but also with other children, so they can make friends and have social relationships. And how can we make our trainings more challenging and enjoyable? That's another question we have. So um, a very short pilot study, we tried to train boys with Duchenne in martial arts. So we changed our materials from wooden sticks to very light uh, uh, sticks. The nicer thing of this type of training in future, because we now did it only with Duchenne boys, just to see whether it's feasible for these boys. But the nicest way would be that we can do it also with healthy children, so they can combine sports from healthy children with boys in the wheelchair or with less ability to walk. We can adjust everything. And this study was done by Mariska Jans and Martha Stessel, and they just submitted their manuscript, and it showed that not in the physical level there was a really a statistical significant difference, but we didn't aim at that, and it was a very small population. But there was a big difference in feeling well and having more satisfaction in and having more belief in their own body by the boys. So I think sports is not only due to good for the physical abilities, but also very beneficial for their social well-being. So in future, I hope many other young researchers will pick up all those questions and take more studies on exercising, because we have so many questions left that we don't have any answers. But uh, being active in itself is already okay, and just don't take over everything from your boys' parents. Let them try to do it themselves, and and only help if you see that's impossible. But training during the day is also doing activities of daily life. That's also a kind of exercise. So I'm pleading that all parents with boys with Duchenne, and also girls with Duchenne, the parents of those children um, will help children to stay active in during the day and not to help them with everything. And hopefully in the future, we can help the children to have a healthy lifestyle as we all need to do. Thank you for your attention.
Thank you, Imelda. That was really wonderful. I so appreciate all you've done. I think that what we are seeing, at least what the Imaging DMD group is also reporting, is exactly as you described in the arms and disuse atrophy, because when the boys are diagnosed, we as parents find ourselves concentrating on the ability to walk as opposed to really encouraging the arm use.